We are back again, guys. This time we have with us a very good friend and a colleague of ours, Dr. Arundati Krishnaraj. A warm welcome to you, Dr. Arundati. Arundati has got a vast experience of more than 22 years. After her post-graduation, she started her own dental practice under the name Delta Dental Care, where she is the founder and the clinical director. Arundhati has placed more than 5,000 dental implants and almost 100 full mouth implant cases to her credit. That's a very great achievement, Arundhati. And definitely, she does a lot of other associated surgical procedures along with the dental implant cases like sinus lift, etc. So let's start, Aru, if you're ready with it.
Yes, Doctor. Let's go ahead. Thank you for introducing me with so much of praise. Try to be humble and do what I can. So let's go ahead.
Pleasure having you, Arundhati. What's the basic difference between a dental crown and a bridge? Probably you would have heard this question in your practice as well numerous times. So,
right.
Yes.
So, like as you said, see, crowns and bridges are the most commonly used restorations in our dental practice. So
Right.
Now what is a crown and a bridge? Now, crown is which covers a single tooth, whether to restore it back to its strength and function. Like if there is a decay of the tooth, or there is a wear of the tooth, or the tooth is broken, fractured. So to cover the tooth, to restore back its form and function, we give it a crown. So it is the crown is given for a single tooth.
Right.
But whereas a bridge is given to replace a missing tooth. If there is a missing tooth in between, that is to bridge that gap, we give a bridge.
Absolutely.
So the bridge covers two teeth with the replacement of a missing tooth in between. So that is what is a basic bridge or a crown.
Yeah. And you can even have cases where multiple crowns are there, for adjacent teeth right next to each other. So many people get confused with those separate crowns to be joint crowns on the existing natural teeth and they call them as bridges. And when you actually get the radiographs and you realize, okay, there's a tooth missing over here, or maybe there's no tooth over there, and that's how we realize that these are joint crowns or bridges over there. Right, absolutely.
Yeah, right. Sometimes joint crowns are given if the crown height or if the tooth height is very shallow, so it's not going to withstand or hold a crown by itself. Then we may need to connect it to adjacent teeth to give it more strength and support. But in that way, it may not be called a bridge. Maybe it's called joint crowns. But bridge is usually to replace a missing tooth. So it may be a single missing tooth, or it may be multiple missing teeth. So depending on that, we give a bridge to bridge the gap between the missing teeth.
Next question, again, a lot of patients ask about this in our everyday practice. What are the different kind of materials and that I use for crowns and bridges? And if you can give your insight as to what is good for what scenario, for what situations, things like that.
Right, Amar. So we have nowadays, actually, when you say compared to what it was earlier, I mean, you're coming to the say past 15 years, but lately more amount of zirconia crowns have been used. So there are different varieties. One is a metal alloy. You can use a full metal alloy. The other one may be a metal fused to porcelain. And the other one now is metal-free restorations, which are coming up, which are zirconia. So these are more popular right now. They are they have better strength and better aesthetics. So these crowns are more popular among our patients, and so these are what being extensively used now with the advent of CAD-CAM and everything. So it's easier to give maybe it's faster to give a zirconia crown to patients, and within the very less from the time of the patient walks in and then he walks out with the crown. So the time taken is very less, and then it's quicker because of the advent of CAD-CAM technology, which is used in prosthodontics right now.
Yes, CAD-CAM, I think it's used for almost every case now.
Right. Yeah. So now everything is right. So now actually CAD-CAM is replacing everything. Yes.
Any particular reason why certain types of crowns are preferred for the anterior teeth and certain types are preferred for the posterior teeth, especially if you're talking about the pressed ceramics, the lithium disilicate crowns?
Yes. Talking about pressed ceramics and zirconia, now pressed ceramics are more aesthetic. They're used in a layering technique and most widely used for the anterior teeth, or we call it the front teeth. So it gives better aesthetics in terms of translucency. You want it to look more like your natural teeth. So these pressed ceramics
call as a lifelike appearance. I'm sorry.
Appearance. Yeah. Right. So to give a more lifelike appearance so that the light reflects on the tooth and looks more natural. So we go for these pressable ceramics in the anterior teeth, or maybe zirconia with layering in the more of the front teeth. But in case with this, if it is for the back teeth or the posterior teeth, we rather go for something more aesthetic, not less aesthetic, but more of strength. Right. So we go for either full contour ceramics, full contour zirconias, so that it withstands the forces of the mastication or withstands your forces of eating. So it doesn't fracture during function.
What would you say would be the average life of these different types of crowns, considering the different type of materials that we spoke about? So which is the longest lasting, which is not so long lasting?
Right. See, now we cannot give an exact day or elongation, duration of time. But I would like to say, see, maybe if it is successful, if a bridge or a crown lasts for about 10 to 15 years without any problem, without any issues of visiting the dentist because of maybe to replace it or anything, it is said to be a successful crown or a bridge.
Absolutely.
Now, yeah, of course, it depends on a lot of factors like the patient's oral hygiene and how it is done. A well-made bridge or a crown, if it lasts for about 10 to 15 years, is said to be a successful time that it is lasting in the mouth. So that doesn't necessarily, that also tells us that we have to visit a dentist every 6 months, not only to show a generalized checkup, or also to have a checkup with the existing crown and bridges if there is any problem associated with it and needs a dentist intervention at that time. So I suggest that every patient should visit the dentist once in 6 months so that we can catch the problems at its earliest point.
Absolutely. At least we can make the patient aware of something is not going right in his or her mouth. Right. Also, I would like to add a couple of points. A lot of labs come with lab-given warranties for different kinds of crowns, especially if you're talking about monolithic zirconia crowns, and they come with a 15-year warranty, or the DMLS crowns, which come with a 10-year warranty. So that also gives a little bit of peace of mind to the patients who always have that thing on the back, how long is this crown going to last in my mouth? So, yeah. The lab-given warranties play a large part here. Yeah.
Right. So it's an average period, say 10 to 15 years is if the crowns last. That's what the warranties the lab offers for different types of crowns. I think it's a good way that it lasts 15 years and it's good, I would say.
Yeah, and normally they do last. I mean, as per our experience over the past so many years, a good crown easily lasts for a good 14-15 years. Absolutely. The next one, any special crowns that you recommend for the front teeth? I mean, a lot of patients wonder if crowns can be fixed or placed on a front tooth, or many people have this misconception that crowns are meant only for the back teeth. Your insights on that, please?
No, No, definitely. Crowns can be used even for the front teeth. Mostly for the front teeth, maybe when you're doing a smile designing or when you want to change the color of the tooth is discolored for any reason or it is fractured. So we do give crowns for the front teeth also, not mostly for the back teeth. But the most common reason why you give a crown is because if the tooth is decayed and you've done a root canal, and then you cover the tooth to restore back its form and function, basically when it is decayed. That is what is the single crown. Very widely nowadays, in fact, even to change the smile, or if the teeth are crooked, you want to change it by doing smile designing. So crowns and bridges are given to the front teeth also.
How often would you recommend giving anesthesia, local anesthesia like lidocaine or novocaine for a crown procedure? Because again, even after getting a root canal treatment done, people do ask, oh, is the crown preparation going to hurt? And I have to tell them, your tooth is already dead, so there is no question of pain for the crown preparation that we're going to do. So again, a little bit of your inputs on that front.
Right. Like I said, the most commonly reason why we give a cap is after a root canal. So once the root canal is done, obviously the tooth is numb, the nerves are removed, so the tooth is not going to be sensitive to any preparations that we do on the tooth. So we do not need an anesthesia for a root canal treated tooth. But if we are placing a crown or a bridge on a tooth which is vital, so then some amount of anesthesia is required so that the patient is comfortable and does not feel sensitive, because we need to prepare the tooth to receive the crown. So we cannot place the crown over the tooth without preparation. So that some amount of removal of the enamel may be a little sensitive to patients. So some amount of anesthesia is required when you're doing a vital preparation of the tooth.
All right. Fine. So thank you. I think we have addressed most of the most basic questions that our patients or the viewers may be wanting to know. We'll come back again with Aru for more difficult topics like smile designing and especially bruxism. We are going to come out of a small question answer session on that particular front. Thank you for your time today, Aru. I hope the viewers enjoy our little small discussion that we had. Thank you once again. Thank you for your time.
Thank you, Amol. Thank you for giving me an opportunity to share my experiences. Hope we do have these interactions much more. Until then,
yes, we shall. All right. Thank you once again.
Bye.